Okay, I got your document you sent. Sounds like you're having some nausea.
Well, I was. It's mostly gone now.
Okay.
But yeah, I was throwing up a lot.
How many weeks are you? How far along are you in your pregnancy? You say
22 weeks.
22 weeks. Wow,
Yeah.
fantastic, great. So let me pull up the document you sent, and we can go through that. So give me just a general update then, verbally. Then the stuff we'll go over that too. But so
Okay. Yeah, I mean, pretty much from the get-go, like right after I saw you in May, the nausea and vomiting started for up until about 6 weeks ago.
oh,
Um, so I was throwing up like a couple times a day, and it was just like I was bedridden. I had no energy or anything like that.
wow.
And then the heartburn started at some point, like maybe in the middle of that time, and now it's still like I have heartburn pretty much every day. Um, but I have more energy and I'm not throwing up, so that's good. And I'm starting to be able to take some of my supplements again. Like I had to stop all of them because they would just make me throw up.
Yes.
So yeah, I've been taking folate again for about 6 weeks now. And I just started a new prenatal a few days ago. And then I'm able to take my fish oil.
Good.
And then like I've been able to take like vitamin D, inositol, and magnesium like the whole time. I've forced that down, but other than that, yeah, it was rough for a while.
Okay. So the most important thing is when you give birth to take all your essential fatty acid supplements to optimize your breast milk nutrient density, right? You're planning on breastfeeding, right?
Yeah. Yeah.
How long do you plan on breastfeeding for?
I mean, as long as I can,
As long
really.
as, long as you
Yeah.
uh, uh, at least 8 months.
Oh, yeah. Yeah.
Perfect. Because the research
Definitely.
shows 6 to 8 months can mitigate like all types of childhood developmental disorders and autism, and some of these neuroinflammatory responses take place in the brain. They can be completely changed in studies where they compare breastfeeders to non-breastfeeders with people that breastfeed. It's one of the
Yeah.
most effective things you can do. So even though you weren't able to take your supplements through the first part of your pregnancy, as you get, you're in 22 weeks now, even through the end, and even when you start breastfeeding, just really take your essential fatty acids and your prenatal supplements to I don't think you were significantly nutrient deficient before. I mean, you've always been healthy. You've had some respiratory issues and some brain fog issues, but you're not like you're unhealthy, like you're
Right.
just really nutrient deficient or anything.
Yeah.
So let me pull up this document.
Yeah. That kind of sucks because I did that test like right at like when I was starting to come out of the nausea. So I'd probably been not, oh, I'm sorry. I thought you were pulling up the test results from the two
Yeah,
blood tests I did for you.
yeah, yeah.
Oh, you are. Okay. Yeah, so I don't know if it would is like skewed because I had been throwing up so much and not eating the best, and
Sure.
I don't
Well,
know.
let's start with the nutrient one. Well, actually, let's start from the very. All right. So yeah, it wasn't clear when I was reading this that it stopped. So I'm glad that it said
Yeah.
3 weeks ago, but that wasn't really clear. Okay.
Yeah, I looked at my calendar and it looks like it was more than 3 weeks ago.
Okay.
It was about 6.
So you completed required tests and continued to blood sugar support. Your blood sugar is pretty stable now, despite having to deal with the hormonal changes and pregnancy and all that.
I think so. Every time I feel like I'm maybe having a fluctuation, I like do a finger prick and it's always normal. So I'm like, I don't know if it's not accurate or what.
What about so what you're seeing in your blood is one thing, but also how glucose gets into your cells and into your brain is a little bit different, right? Because
Yeah.
you can only measure what's in your blood. So if you feel shakiness, lightheaded, irritability, and
Not really that. I get more so just like headaches a
oh,
lot, but I don't know if that could be from anything.
yeah, it's tough to say when so many things are shifting during your pregnancy. Hydration is one of the most common. Are you hydrating now? I mean,
Now, but when I was going through the vomit time, it gave me such bad heartburn to drink water and nausea that I was drinking maybe like six cups at most.
okay,
And
but
now I'm back up.
okay, great. So you're eating a lot of eating. So you're eating sources of essential fatty acids and vegetables and fermented foods all the way through, or not really?
Only when I can.
That's
So yeah, I had a lot of food aversions. Like pretty much everything I had been eating, I couldn't eat anymore. Um, including like fermented foods, but I try to eat them whenever I can.
No problem. I mean, you have to understand, like, our bodies are so awesome. I mean, your body, women's bodies are awesome because they can deplete you of every nutrient you need to give it to your fetus.
Yeah.
As long as you have a little bit of good stuff, it's,
Yeah.
totally perfect.
I'll survive.
Yeah, okay. Nausea multiple times a day. Stuff through heartburn. You talk about fatigue throughout the day. Yep. Bad afternoon headaches, brain fog, all the day, dizziness frequently. Okay, some of this stuff is so hard because so much of these are pregnancy related, right?
Yeah, I know.
I hope to discuss my pregnancy experience this far, what I can do to feel better, any tests that would help, next steps for treatment plan. Okay, we can go over that. And is there anything else you'd like to know? I have not been the best dieting during pregnancy. That's okay because of the nausea. I eat mostly paleo diet, bunch of different gluten-free items, even mostly vegetables and grain. Good. Okay, so I'd like to know about some pregnancy-related issues like a glucose tolerance test in 3 weeks. Do you want to do that?
I don't know. I just heard like I read somewhere and I can't find it anymore that somebody said like the glucose test is silly and like can be harmful. And I don't know.
Yeah.
I have to do that. I mean, the gyno wants to do it.
I don't think it's harmful. It's just basically 75 milligrams of glucose that you wait 3 hours to eat. I don't think it's going to do anything.
Okay.
And they're always trying to make sure you don't have gestational diabetes.
Right. Okay.
Definitely, I would not worry about it if that's a concern for you.
Oh, okay, perfect.
Has that scheduled in 3 weeks?
Yeah, actually, it's about 2.5 now, but yeah.
Okay. Any issues during my last ultrasound? Echogenic bowels, and baby told not to worry because all the tests were normal. Okay, yeah, that's just increased sound frequency. Vaccine during pregnancy, yes or no? Oh, geez, I can't answer that for you.
Right.
That's
do they? Because I just randomly saw that would be something I might have to do, and I had no idea. But I read from Dr. Rhonda Patrick, she had mentioned something about like doing it the day that you give birth or something, and then you can give your antibodies through breastfeeding, and that would cause like less of a immune reaction during pregnancy if you are prone to those.
Yeah, I'm not sure about that, to be honest with you. It's not that I think it's wrong. I just don't know about it.
Okay. What did your wife do?
Yeah, we had our own thoughts about it, and so I'll tell you what I did as a parent. What I did as a parent is I went to the immunologist I knew and trusted the most, which is Aristo Vijnani. Okay, he's a PhD immunologist, and I go, "What would you do?"
Yeah.
And I'm not saying it's appropriate for you. He said, listen, first of all, he goes, you have to know as an immunologist, classically trained, I believe in vaccination. I go, okay. And I go, so what would you do? He goes, well, I don't know if we need all of it all at once. And I don't know if we need all of those together. And he's like, certainly the immune system is until you develop the first 6 months. And like, those are the things you have to consider. Like some of the, and also it depends on your state. Like you could have, if you were against the vaccine or something, what the regulations are. Like some people have like the hospital come into your house and like push you into doing vaccinations if you don't want to do it. Are you working with a midwife, or are you going to the traditional hospital? Or
I'm just doing traditional hospital, but I might like get a doula and like try to. I don't want to do what's it called? The pain epidural. Yeah, I don't want to have to do that or any drugs if possible.
See, the thing with the vaccine research is if you look at it purely as a data analyst and researcher, there's a couple issues, unrelated to being like an extremist anti-vax or pro-vax. Okay, but just one of it is when they do safety studies, they're looking at the whole population, large populations, and if there's adverse reaction to small groups, there's a small signal, and it all gets blended into the big one. So safety is not always assessed. And then they're not doing, the NIH doesn't approve small sample studies for individual risk factors for any funding because they're so worried the whole world would get anti-vaxxed. Yeah. So just like we saw, like with the COVID vaccine, there were some susceptible groups that maybe have some reaction with vaccinations, some people don't. And well, so that's one of the things. As far as autism goes, like the link between autism and vaccination, what really shows is the research shows that autism develops way before vaccination. So what happens in autism is during fetal development, the neurons aren't migrating to the surface of the brain, and their immune system is heightened. Their brain inflammatory responses are heightened during neurodevelopment, and then it's possible that once they get the vaccine, it just triggers what their already inflammatory state is. So I personally don't think vaccines cause autism, but I definitely think if you have a child that has autistic development characteristics during fetal development, a vaccine can definitely flare them up.
Okay.
And then most people that have autism, like they notice like 18 months, that 2-year window, they severe regression. That's when all the vaccine loads take place. But that's also when the child immune system fully develops, unrelated to vaccination. So there's many cases of autistic children having these regression periods at 18 months with no vaccines. So there's like that overlap where the vaccine load is right at the 18 months, and parents obviously what they observe is real. They see their children getting this load at that time period and also seeing an adverse reaction after vaccination. So they think it's a causative thing. But when you look at the research where they looked at fetal brain activity right after birth without any vaccinations, and how these migrate changes, and even PET scans would look at microglial inflammation of the brain, they're already inflamed way before they have these vaccination patterns there.
Okay.
So I don't think it's causative. But then the biggest concern, like we had as parents, was, do we really want all that toxic load? Because there's a lot of adjuvants. And then the argument is in the research world, like, if we take anyone's blood and we measure some aluminum and mercury and lead, you're going to already have those high levels in them anyways. Like, so what's a little bit of trace dose? And then, so that's one of the arguments, right?
Yeah.
The other side of the argument's like, well, those chemicals bind to proteins and change the proteins, and they can be more immunogenic, and they can cause an immune response. So those are the two arguments.
Yeah. Yeah.
And ultimately, I'm going to end with, I'm not sure what you should do. You should kind of decide what's best for you. I think delay makes sense, and maybe not doing as many makes sense. So I just can tell you, as parents, we thought there's some of these diseases just is not going to be a factor for and then also, do we really want to do them all at once? The vaccine schedule. So we worked with a pediatrician named Bob Sears. Have you heard of him? He's written many books on vaccination and different schedules, and everything from arguments from one side or the other. But if you look at Bob Sears, like the department store Sears, he's written a lot about it. And ultimately, you and Toby need to like sit down together and decide what the issues are and where you want to go. So I'm definitely not anti-vax either, but I also understand the concerns, and like it's such a personal call. And then do you feel guilty? Do some things happen? Are you a bad parent? One or the other. It's a hard call. That's the question I hate the most. I know the research. Okay, now let's go to your question forms. So definitely, these frontal lobe symptoms. Your brain is not at its best right now with some of these areas in the frontal lobe, especially focus, attention, concentration, decision making. But those are going to be thrown off too with your pregnancy. It's hard to see with pregnancy and which are not. Okay, blood sugar sounds like you have figured it out. I mean, you have very little symptoms of your blood sugar symptoms, like hypoglycemia. Those are pretty good. You have a lot of fatigue after meals and most sweet after meals. That could all be pregnancy related too. Like the biggest concern with you is being hypoglycemic, your blood sugar dropping. So you also got to be careful too because of carbohydrate loads. I mean, you got to eat, but you don't want to like totally pass out.
Right.
So your insulin levels during your fetal development can also impact body composition for the rest of your life. So if you're like overeating and overconsuming, and like definitely don't want to be. My body craves a gallon of ice cream. I should be eating a gallon of ice.
Oh yeah. No, I'm not doing that at all. I don't think. I mean, maybe a teeny bit, but no.
Okay, so this is billion to one. So, this is when they check for genetic sensitivities. Okay.
Yeah.
They're all low risk. That's great.
Yeah.
And then those are just your genetic screen tests.
Mhm.
RH testing. Okay, this is your recent blood test. So this one was 527.
Actually, no, I have one that I just did like a week ago.
Oh, you did? Okay, well, let me look at this one first. So this one on 527 is showing you're a little hypothyroid here. Did you get your thyroid managed?
Yeah.
All right. I mean, it's so critical. You get your thyroid levels normal during
Yeah.
pregnancy. Okay.
Yeah. I immediately, like the next day, I think, switched medication to be higher after
Oh,
I found that out. Yeah.
okay. So then you retested that. Yeah.
Yeah.
And then these are all just normal here. Let's go back. And it came back normal?
Yeah.
Do we have that? Let's see. This is the one on 727. Let me
I
go
don't
back.
know.
527. Okay.
This might be a different.
Yeah, I think it's in sequence.
Oh, okay.
So 527, we're good. Your electrolytes, all these look healthy. Iron levels look a little bit. No, they're okay. Everything's good there. White blood cells are good. Red blood cells are good. Homocysteine is good. T4, T3 levels look good. Okay. So then we get into June. Everything with your white blood cells still looks good. Red blood cells look good. And they're checking you for rubella, HIV, all negative, hepatitis, varicella zoster. Okay. Now your TSH here is 1.55. So it's under control. So you're not hypothyroid during your pregnancy.
Yeah. Now it's actually lower.
Okay.
Um,
Let's see. This is the one that's 7. Glucose is 80. So this is a sign your blood sugar still could be dropping a little. You may have to eat more frequently. The rest of your blood cells look good here. Iron, ferritin, glucose 83. T3 reverse value is fine. You're not underconverting. Vitamin D levels are good. So as long as your TSH is lower, 1.63, yeah, you're not hypothyroid. Like that's a big deal. So right here, your blood test shows it's 1.63.
yeah.
Date of this test, I think was July. Let's see.
Yeah. I think July.
July. So 1.63. So the next 3 months, you're fine. And the most recent blood test you have is just your pregnancy test, was okay too, right? So you're getting it checked every month or what?
Yeah, it had been, I think we skipped a month, and so then I ordered my own test because I just wanted to make sure it was fine and to show you before our meeting.
Yeah, maybe I don't have it in a pile Susan organized for me, but
It should be all the way at the bottom. It's like from last Friday,
oh,
so it's really recent.
oh yeah, yeah. I'm sorry, here it is. Usually, if there's error, it's not her, it's me. 0.96. Yeah, you're fine.
Okay.
Let's go through the order and sequence. And
Okay.
so basically, you showed up hypothyroid. It sounds like you took care of that right away. You should still check every month.
Yeah.
Okay.
I agree.
Then here's your essential fatty acid. So I want to make sure you don't have any deficiencies going into pregnancy with it. And, the diamond is you, and you should be in the green.
Mhm.
So what they're showing here is your omega-3 acid levels are good. Your EPA is a little bit on the lower end of normal, like close to the border, but your DHA is good. So this isn't deficiency. It's just like not perfectly ideal. So you're not deficient. Okay. If you're taking some fish oils, nothing is even better, but you're not deficient. Okay. And then EPA and DHA are essential fatty acids, meaning you have to get it from your diet. Your body can't make it. So if you're taking fish oils, it's a good idea. Okay.
Yeah.
And then you have some of these higher omega-6. Were you taking omega-6 oil before?
Is that just like what's in olive oil and other?
Those are omega-9s. Olive oils are omega-9s. But were you taking any kind of essential fatty acid supplement before?
No.
Yeah.
Mm-mm.
So like if you look at the, if you look at the diagram, I mean, you're just a few points off the higher end. I personally don't think that's an issue at all, especially with these omega-6 ones that are, you're not getting like arachidonic acid is a little bit higher on the other end, but that could be, some of these things could be triggered because you're having constant allergens and allergies. It'll raise your arachidonic acid, these pro-inflammatory mediators a little bit. When they're high like this, it's not like you severely restrict your diet. They're usually triggered by an immune inflammatory response.
Oh.
So that's what.
Oh, could it be from being pregnant or no?
Yeah, pregnancy can impact these too, but more likely it's your immune response. Omega-9 levels, again on the higher end, and some people argue like this is what the population should be, but with these beneficial fatty acids like omega-3, omega-9s, you should be on the higher end. Okay, the ones that are pro-inflammatory like arachidonic acid, the ones you're concerned with, not to be high, but those are more likely immune related. And then what you would normally do is just take anti-inflammatory stuff you're already taking.
Yeah.
So the biggest concern we had going into pregnancy is just deficiency more than anything else.
Right.
That's one thing. Trans fats, this is like coconut fats, or coconut fats.
Yeah, oh yeah, a lot. So I'm not surprised.
This is why it's a little high.
Okay.
And I wouldn't consider that to be a big issue with what you're doing. Some people would see that and go, that's too high, and that's not a good idea. Okay. But overall, you're on the higher end of things versus any kind of deficiency, and we're really most concerned with deficiency.
Okay.
This one's high, which some people don't like because it's a trans fat, but it's coconut trans fat and other inflammatory stuff. I wouldn't be too concerned. How much coconut fat do you consume all day, every day?
Yeah, I mean, that's what we cook with, and I use it as like a butter substitute. Like, probably, I don't even know, like personally, like a quarter cup, maybe. I mean, that might be a little high.
Yeah. It's okay. I personally don't look at this as being a problem. And if anything, I'm happier that some of these are on the higher end of the normal population. This is you being compared to a quartile of the population. These are fatty acids you need. So we're not seeing any signs of deficiency that's a concern. Okay.
Okay. So,
then here's your micronutrient report. I wanted to make sure you didn't have any nutrient or mineral deficiencies here. It's the same kind of thing. You look at the scale, you kind of see where you're at, right? You want to be in the green. Your B vitamins are within normal limits, but they're starting to be on the lower end. B vitamins, that's all that really shows. Your D levels are all good. Your manganese, calcium, zinc, copper, they're not deficient, but they're on the lower end. So taking more minerals could be useful. And then these markers aren't that great. Fructose sensitivity, they use glucose insulin interaction, they're not that great. Chromium, again. So your minerals are not deficient, but they're on the lower end. We're concerned about pregnancies if you're in the gray. Okay. That's like, oh my God, we this is severely deficient. Like we need to worry about this. You're not in anywhere where these nutrient levels would impact a healthy pregnancy. Okay. And then they just look at antioxidants, sulfur amino acids. And again, you're in the lower end of some of these, but not really deficient. Red flag going into a pregnancy would be if you're in the gray with any of these. Okay. Right. So this is a summary chart where they show you all the different status. You're not really in the red with any of these things. Okay. I mean, in the gray. The levels sometimes are suboptimal. But when you look at these panels, like that happens with most people. It's not like everyone has peak levels of every single nutrient. And a lot of times people like taking it right before the test, their levels are a little high. Your antioxidants, your N-acetylcysteine is still like right on the borderline, alpha lipoic acid. But there's many antioxidants that can compensate for that. And then doesn't need you have to jump into it. Alpha lipoic acid can really sensitize your blood sugar and drop it. So I don't think it's a good idea right now. Oh, okay. But if you're taking it, it's fine too. Are you taking it or no?
I don't think so. Is that?
No, it's not something that we individually had you taking hundreds of milligrams or anything. Okay, it's just like a chart. This is total nonsense. I don't know why the labs do this. They pretend like the cellular nutrient thing actually works, but it looks nice. But it's not realistic to what's happening in the cell. in any case, you don't have any severe essential fatty acid deficiencies, any nutrient deficiencies, anything that would impact your pregnancy, or it's not a factor. The only thing actually in your entire whole workup that could have been a factor impacting your healthy pregnancy was your TSH. So it's good you caught that and change your dosage. Keep monitoring every month.
Yeah.
Dose is 72. That's a sign. Like that's we like to anything above 85, we're expecting blood sugar drops. So you can have a tendency for all types of hormone imbalances and blood sugar fluctuations during your pregnancy. And then if you look at all your other test results, everything else looks pretty good. Like you don't have any signs of any anemias or iron deficiencies. Sometimes people develop those during pregnancy. You have any tissue breakdown. So for the most part, despite the nausea, doing pretty good.
Yeah. Well, that's good.
Now, essential fatty acids, like the fermented foods, all those things, that's the most important thing as you start breastfeeding and last pregnancy. And then, yeah, I mean, you're good. The red flags would be like, how's your blood pressure, by the way? Have you been checking?
Yeah, I mean, it's always a little not low, but like 100/70-ish.
Yeah. I mean, the big things that cause complications of risk during pregnancy would be being overweight, which you're not, being insulin resistance, metabolic syndrome, which you're not, being hypothyroid, which you're not, and like being anemic or having gestational diabetes. So your doctor wants to do a 3-hour glucose tolerance test. That's not going to be harmful for you. It's just you're not gonna like it. No one likes it.
Yeah.
You're gonna fade. You have a tendency to already be hypoglycemic. You might get shaky, lightheaded, irritable, all that stuff.
I know. Yeah, I figured.
Yeah, but it's a very nice test to really see what's happening with glucose and insulin.
Okay.
So let's go over this here. So let me go over this form again. Let's make sure I'm not missing. Okay, continued support blood sugar, take supplements, nausea, fatty acids. How's your brain fog through all this, by the way? Is it worse, better?
I don't know. I feel like every day I have like some congestion or like head pressure, and I don't know if that's the same thing as brain fog or related to it. Yeah, I mean, my memory's just gotten a little bit fuzzy.
Worse than usual or not, or about the same?
What?
Worse than usual or about the same?
Oh yeah, worse than usual.
Worse than usual, yeah. Okay. Has anything improved during your pregnancy?
I mean, I think I've been calmer.
So anxiety went down?
Yeah.
So the chief complaints you initially had when we first did a workup together was fatigue, anxiety, depression, brain fog, allergies, asthma, headaches, dizziness, irritability, moodiness, constipation. And I think once you stabilize your blood sugar, there's some changes in your like moodiness and energy fluctuate, right?
Yeah.
You're still having a hard time with the brain fog and allergies and allergens and all that stuff.
Yeah.
And then we can never really get deeper into that. But it is what it, can we do? So do you have any questions for me? I mean, I think all you have to do now is just focus on getting back on those prenatal nutrient supplements, staying as healthy as possible, having a healthy pregnancy, continuing to eat those things, breastfeed.
Yeah. Is it okay to like, should I take a probiotic now or is it pointless?
You can definitely take a probiotic. What if you feel like it's going to be beneficial to you? One of the things we recommend for you is like Enterovite, which is short chain.
Yeah.
It helps you make your own probiotics.
Right.
The thing with probiotics is that they work differently for different people. We don't know like which strains work for different people. If you find a strain that works for you, you may want to experiment with different probiotics. If you want to add probiotics to your mix, you can definitely try different ones because they may not all have the same benefits for you. Like you might try even different manufacturers and then see if one really works for you, you notice it's helping you. But you don't have a lot of symptoms, do you? Like gastrointestinal symptoms?
I mean, I just feel like my stomach always feels off and sometimes I'll be really bloated after meals and stuff, but I just don't know what's like just going to happen because I'm pregnant.
Right. That's tough. Because that's pregnancy too. Yeah. Won't hurt you. Like it's not.
Yeah. Okay.
And then selenium, you taking that too or not?
It's in the prenatal, but I wasn't able to continue that.
That's fine. But if you're taking it now. Selenium has been shown to slow down postpartum thyroiditis.
Oh, okay.
Some people have their Hashimoto's flared up right after pregnancy, and they get severe postpartum depression and all those things. So
Yeah.
the short chain fat, the enterovite and selenium, short chain fatty acid and selenium, just to make sure you want to continue on those. So you can reduce some of the risk that's been associated with those nutrients being helpful for postpartum thyroiditis. That's the other thing you would have some risk for is like after your delivery, having your Hashimoto's system flare up.
Okay.
So selenium helps with that, and as long as definitely stay on the supplements. Essential fatty acids helps, and if you have any severe symptoms, it'd be a good idea to see what's happening with your thyroid right after pregnancy, especially TPO and thyroglobulin, because you may have some risk for those mechanisms.
Okay. What about like am I gonna see you? When will I see you next?
Whenever you would like.
Okay. Because I have questions about I like the labor and delivery, like if you have any recommendations for like the drugs or anything like that.
No, I mean, I think once you're in their world, it's just best to. Are you working with a midwife, or are you working you're not working with a midwife, right? No.
Just a regular, yeah. I might for like the next pregnancy, but for this one, I just feel like I'd feel safer probably at a hospital.
I think it's a good idea. I mean, you have a different opinion. I can only tell you what we did as parents. We felt it was safe. We worked with a midwife, and then we also felt comfortable going to the hospital with the midwife, and we went through the whole thing. So the most important thing is physical activity and exercise all the way through your pregnancy to have the easiest labor. Being anti-inflammatory, having lots of essential fatty acids, having movement, having exercise. Those are all the things. Having your blood sugar insulin control, which you already do. Like you're not diabetic. I mean, you may have your blood sugar drop a little, but that's not a big deal, or complications at least. Yeah.
Okay. So you did a birth at the hospital or at home?
We did both.
Okay.
So we started with a midwife, and then we ended up having it at the hospital.
Okay, gotcha.
But listen, they're great. I mean, there's babies being delivered all the time. It's all about being healthy as your baby is developing. That's the most important. And then the second part is just making sure you can breastfeed with the most healthy nutrient concentration of breast milk you can afterwards for as long as you can. And that I think it's going to be great.
Okay. Yeah. The other thing Toby actually thought about was we want to move. I don't know when we're going to be able to, but
what are you guys going to move to? Because your environmental allergens, both of you, it's so bad there.
I know.
You can't get out of it. And the thing was, when we did the IgE food allergy test, the immune environmental testing, like all the stuff that's around your home, you're getting exposed to all the time.
I know.
That when you would have your dog that was living with you out of your antigen world trigger, it would make a big difference. It didn't. So where are you guys thinking of going?
We don't really know, but we both like the mountains, but then I have like that problem with the altitude where my brain it just like freaks out. So we didn't know if like that's something I could acclimate to over time, or is it something we should avoid? Or
I think you can definitely, and I think those things can happen sometimes just because your physiology is off. You could have been in a low blood sugar state. You had 10 before and then been up there, and then you got a little hypoxic, and I would definitely. You might want to see how you feel up there, but I doubt it's going to be an ongoing issue.
Okay. Yeah, that would be good because we've been avoiding going anywhere above like 8,000 feet since that happened. So
I wouldn't do that.
Okay. I don't know if do you have any other questions?
Maybe for the heartburn or?
Oh, I mean,
what's that?
Do you have any recommendations for like the heartburn? I pretty much can handle it, but if I am having a really hard time, I'd take like baking soda and water.
Yeah, if that's working for you. Sometimes it's just your fetus, your abdomen's anatomy is changing, and you're changing the pressure of your stomach, and regurgitation is a part of that. whatever gives you symptom relief. I mean, deglycerized licorice, you could use that. DGL.
Okay.
Soothing teas like DGLT may be an easy way to do it. You can order off Amazon.
Okay.
See if that gives you some relief. You can try with, make it super saturated with like more than one tea bag.
Okay.
Drink that.
Okay. Yeah, it's super annoying.
Yeah, I'm sure. DGL. DGL is good though. It's flavonoids. It helps soothe the stomach.
Yeah. Okay. Okay.
Good.
Yeah, I think that's it.
Okay. Well, you're on your way. Your life.
Yeah. Yeah.
So everything looks good. You're totally set. You didn't have any nutrient deficiencies going into it. It's fine that you were able to follow the protocols. Just follow what you can, and then you're good. Don't worry about it.
Okay.
Okay.
All right. Thank you. Bye.